So inflammatory bowel disease is talking about two main diseases, Crohn's disease and ulcerative colitis. They're both chronic diseases. They affect a lot of people at different ages, but majority of the time people are diagnosed in their 20s, sometimes 20s, 30s years of age. They're chronic and they require close attention and follow-up with the gastroenterologist, and sometimes people need to be on medications for an extended period of time to get their symptoms under control. I mean, the symptoms can sometimes interfere with people's quality of living, and I think that's what draws me to wanting to help these people, because I get to see people when, you know, they're in a state of not feeling so well and see them through to finally getting better and getting their quality of life back. And, you know, I thought that was a big draw to why inflammatory bowel disease was so interesting to me. Some of the symptoms of inflammatory bowel disease include abdominal cramping pain, diarrhea. Sometimes people will be losing some weight, some bloating. In some instances, they'll see blood in the stool. A lot of these symptoms can actually overlap with other conditions that we see a lot in gastroenterology, which is why, you know, it's important to come see the GI doctor and let them sort of sort out what's going on. There can be some long-term consequences of uncontrolled inflammatory bowel disease, so you always want to stay one step ahead of it, diagnosing it early, starting treatment early, and making sure that patients are getting their routine surveillance colonoscopies and routine blood work to make sure everything's under good control is important, because the idea is really to get people feeling better but also prevent any complications from these diseases as well. In the short term, sometimes we use things like short courses of steroids to get the symptoms under control, and then we may use some medications in pill form. One of the ones that's been around for a long time is a medication called mesalamine, which comes in a lot of different formulations. There's pills, there's enema versions of this medication, and we use this oftentimes for patients with ulcerative colitis. And then, you know, there are a lot of the newer medications, the medications we call biologics, which people see all the time ads on TV for, like Humira and Entyvio and Remicade and Stelara. And these are all medications, many of which have been around for a while now, and we know that they're very safe medications, but they're also very effective medications, have really changed the game with how we treat inflammatory bowel disease and the outcomes for patients with inflammatory bowel disease.